Imagine stepping on the scale every morning and feeling as if your own body is quietly betraying you. The harder you diet, the more exhausted you become. Your belly grows softer, blood pressure creeps up, your blood sugar hovers in the danger zone, and every test seems to whisper, you're not trying hard enough. But what if the real story is that a powerful storm is raging inside your metabolism, and your body is not the enemy at all? Dr. Emily Cooper calls this inner chaos the metabolic storm. It is not just one problem, but many forces colliding: insulin, stress hormones, thyroid signals, and fat cells all shouting at once. Instead of a gentle breeze that helps you burn energy, your system becomes a hurricane that traps fat, raises blood pressure, and drives cravings. If you live with metabolic syndrome, this storm may sound painfully familiar. You have likely been told that weight is just a math problem. Eat less, move more. Yet each time you starve yourself, your metabolism grows colder, like a fire starved of oxygen. The body, sensing danger, clings to every calorie, especially around the waist. Hunger intensifies, sleep worsens, and lab results refuse to budge. It feels like failure, but in truth, your biology is simply trying to keep you alive. If you live with metabolic syndrome, you may carry a secret shame, the belief that you simply lack willpower. Yet Dr. Cooper's work shatters that myth. In a true metabolic storm, the brain receives distorted hunger and energy signals. It is like driving with a broken fuel gauge. No matter how carefully you steer, you cannot rely on the numbers. Your struggles are not a moral failing. They are a signal that the gauges need repair. Metabolic syndrome does not shout at first. It whispers through tight waistbands, slightly higher blood pressure, mild brain fog, or needing a larger coffee just to feel awake. Over time, these whispers grow into warnings about heart disease, stroke, and type 2 diabetes. It can feel as though a countdown is hidden in your lab results, but understanding the storm is the first step towards slowing that clock. At the center of the metabolic storm sits insulin, a hormone that acts like a key, opening your cells so glucose can enter. In metabolic syndrome, the locks on the doors grow rusty. This is called insulin resistance. The pancreas responds by making more keys, more insulin. High insulin pushes sugar into fat storage, especially in the abdomen, while leaving your cells oddly hungry. You gain fat yet feel drained, a cruel and confusing paradox. When insulin surges after sugary or refined foods, blood sugar first rises, then crashes. Your brain, sensing danger, sounds an alarm. Eat now. Cravings appear like sudden waves, often for the very foods that worsen the surge. Over time, high insulin keeps fat locked inside cells, like energy trapped behind bars. You may feel powerless before a plate of pastries, but biology, not weakness, is pulling the strings. On top of insulin, stress hormones like cortisol pour fuel on the storm. Chronic stress, from work, finances, or even surviving years of dieting, tells your body to store energy for an emergency that never ends. Cortisol raises blood sugar and blood pressure and can reshape where fat is placed, deep inside the abdomen. It is as if your body is constantly packing a suitcase for a disaster it fears is coming. Your thyroid is like a thermostat for your body's energy use. When thyroid hormones are low, or when cells cannot respond to them, every process slows. You may feel colder, more tired, and find that even moderate portions seem to stick. In a metabolic storm, thyroid signals may be subtly off or overshadowed by insulin and stress, making it hard to know why the engine runs so sluggishly. Changes in estrogen and testosterone during menopause, andropause, or due to other conditions also sway the storm. Declining estrogen can shift fat from hips and thighs to the abdomen. Low testosterone may reduce muscle mass, lowering metabolic rate. The body shape changes, not just its size. Patients often say, "This isn't my body anymore." Yet these shifts are written in hormones long before they appear in the mirror. Let us imagine Maria, 48, with rising blood pressure, borderline blood sugar, and a waistline that feels unfamiliar. She has tried every diet: low fat, no carb, fasting. Each attempt leaves her colder, hungrier, and more discouraged. Her doctor warns of metabolic syndrome and future diabetes, but offers only the old advice: eat less, move more. Driving home, Maria wonders, how can I possibly try harder? Weeks later, Maria notices new symptoms: restless sleep, crushing afternoon fatigue, intense evening cravings. She blames herself, thinking, I am weak, even as she fights through each day. What she cannot see are the hormonal currents pulling at her: rising insulin, exhausted adrenal glands, shifting estrogen. These invisible forces are scripting her choices long before she opens the pantry door. The twist in Maria's story, and perhaps in yours, is that the central problem is not discipline. The metabolic storm rewires how hunger, fullness, and energy feel. Willpower is like trying to hold an umbrella in a hurricane. Dr. Cooper's work invites a radical reframe. Instead of blaming yourself, ask, what is my biology trying to do, and how can I work with it? This question marks the turning point. Metabolic syndrome is a cluster of conditions that travel together. A large waistline, high blood pressure, high triglycerides, low HDL or good cholesterol, and elevated fasting blood sugar. Having 3 or more of these raises the risk of heart disease, stroke, and type 2 diabetes. Think of it as a red warning light on the dashboard, not a verdict but a signal that the engine needs attention and care. Standing in the middle of this storm, you may wonder, is it already too late? The answer is more hopeful than it appears. Biology is stubborn, but also adaptable. The same way, years of stress and imbalance can build a storm. New patterns, medical treatment, nourishing food, rest, and movement can gradually calm it. The question is not, can I be perfect, but can I shift the winds, one small choice at a time? Calming a metabolic storm begins with seeing the entire weather map. That means more than a quick step on the scale. It includes waist measurements, blood pressure, fasting glucose, triglycerides, and HDL, but also sleep quality, stress load, menstrual or sexual health changes, and family history. When all these pieces are placed together, the storm's pattern becomes clearer and new paths forward appear. Because the metabolic storm involves many hormones and organs, self-diagnosis can be misleading. Lab tests, medication decisions, and evaluation of thyroid or sex hormones require a trained eye. Partnering with a healthcare professional allows you to distinguish between normal fatigue and a deeper imbalance. If you recognize yourself in these stories, please speak with your physician before making major changes. In a metabolic storm, not all calories act the same. 100 calories from sugar will spike insulin far more than 100 calories from nuts. Instead of obsessively counting every bite, it can be more powerful to focus on food quality, fiber-rich vegetables, lean proteins, healthy fats, and minimally processed grains. These act like steady logs on the metabolic fire, rather than crumpled paper that flares and vanishes. The timing of your meals also shapes insulin. Long stretches of starvation followed by large late-night meals resemble a thunderstorm, huge surges, then crashes. Many people with metabolic syndrome do better with regular, predictable meals that avoid extreme highs and lows. Think of your body as a child. It feels safer and behaves better when it knows roughly when the next meal is coming. Extreme restriction can initially drop weight, but often at the cost of a slower resting metabolism. The body turns down non-essential functions, making you tired, cold, and moody. A more sustainable approach is to gently reduce portions while keeping meals satisfying with fiber and protein. Instead of an empty table, imagine simply using a slightly smaller plate, again and again, letting your biology adapt. Adequate protein acts like an anchor in a metabolic storm. It stabilizes blood sugar, supports muscle mass, and can enhance satiety. For many people with metabolic syndrome, including a source of protein at each meal, such as eggs, fish, beans, tofu, or lean meats, makes cravings more manageable. It does not cancel insulin resistance, but it can soften the waves, making the day feel less like constant survival. Fiber from vegetables, fruits, beans, and whole grains acts like slow-release fuel. It helps blunt blood sugar spikes and nourishes gut bacteria that may influence weight and inflammation. Imagine your gut as a garden. Fiber is the compost that feeds beneficial microbes, while ultra-processed foods are like pouring bleach on the soil. Over time, a richer soil can gently support a calmer metabolism. Sugary drinks, sweets, white bread, and many packaged snacks act like lightning bolts in a metabolic storm. They send glucose and insulin sharply upward, then crashing down. This cycle can drive fatigue, irritability, and stronger hunger later. Reducing these foods is not about punishment, it is about reducing the electrical charge in an already unstable system, giving your hormones room to breathe. For years, many were taught to fear all fats. Yet some fats, like those in olive oil, nuts, avocados, and fatty fish, can support heart health and satiety when used in moderation. They are calorie-dense, so portion size matters, but they need not be banished. Think of healthy fats as the oil in a machine. Too much can overflow, but too little makes everything grind and squeak. Even mild dehydration can worsen fatigue and make cravings feel stronger, as thirst is misread as hunger. Water does not cure metabolic syndrome, but it is a simple ally. Choosing water or unsweetened tea instead of sugary drinks removes a major source of hidden sugar and calories. Picture each glass as rinsing a little debris from the stormy sky, giving your system clearer signals. Exercise is often framed as punishment for eating. Dr. Cooper's lens is different. Movement is permission for your body to use the energy it has been storing. Even modest activities, a daily walk, gentle cycling, light resistance training, can improve insulin sensitivity and blood pressure. You do not need to outrun the storm. You only need to show your body that it is safe to let go of some of its reserves. Muscle tissue is more metabolically active than fat. Preserving or gently building muscle can help you burn more energy even at rest. Simple bodyweight exercises, resistance bands, or light weights a few times per week can act like crafting armor that protects your metabolism. The goal is not a sculpted physique, but a stronger engine that quietly works for you day and night. Sleep is not simply rest, it is regulation. Poor sleep can increase hunger hormones, decrease fullness signals, worsen insulin resistance, and raise cortisol. Many people with metabolic syndrome describe being tired yet wired. Prioritizing a consistent sleep schedule, a dark, cool room, and reducing screens before bed may seem simple, but it is like resetting the body's night crew that maintains hormonal balance. Because chronic stress can drive the metabolic storm, finding ways to soothe the nervous system is essential. This does not mean erasing all stress, but creating daily islands of calm, a short breathing exercise, a walk in nature, a brief journal entry, even a quiet cup of tea. These moments tell your brain the emergency is over. Over time, lower cortisol can gently lower blood sugar and blood pressure as well. Many people with metabolic syndrome hesitate to use medications for blood sugar, blood pressure, or cholesterol, fearing it means they have failed. Yet, in a severe storm, using sandbags and levees is wise. Certain medicines can assist insulin, protect the heart, or support thyroid function while you work on lifestyle changes. Decisions about medication should always be made with your physician, tailored to your unique health story. Regular monitoring of waist circumference, blood pressure, fasting glucose, and lipid levels is like checking the weather forecast. It does not judge you, it informs you. Small improvements, a few centimeters off the waist, slightly lower triglycerides, may not be visible in the mirror, but they signal that the winds are shifting. Seeing these changes can renew hope when the scale alone seems unkind. Even with careful work, there will be days or weeks when old patterns return. Stress spikes, sleep crumbles, and the pantry calls. This does not erase your progress. Storms ebb and flow. A flare of blood sugar or a temporary weight gain is data, not a verdict. Instead of asking, "Why did I fail?" you might gently ask, "What shifted in my environment and what small adjustment can I make now?" Back to Maria. After yet another failed diet, she decides to look beyond willpower and finds a clinician familiar with metabolic syndrome and hormonal balance. Together, they review her history of stress, sleep, menstruation, family diabetes, and lab trends. For the first time, the pieces are treated as one story, not scattered complaints. She feels both frightened and deeply relieved. The storm finally has a name. The plan they craft is not dramatic. It includes medication to improve insulin sensitivity, small shifts in meal timing, a gentle walking routine, and steps toward better sleep. Over months, Maria's numbers begin to change quietly. Fasting glucose eases downward. Blood pressure softens, her waist begins to breathe. She still has hard days, but she no longer labels them as personal failures, only as weather changes. Living with metabolic syndrome can erode self-esteem. Yet research suggests that people who practice self-compassion, speaking to themselves as they would to a dear friend, are more likely to sustain healthy behaviors. Shame shuts us down. Kindness keeps us curious. In the center of the storm, imagine building a small, warm shelter inside yourself, where you are allowed to be imperfect and still worthy of care. Trying to calm a metabolic storm in isolation is exhausting. Support from family, friends, or patient communities can provide both accountability and comfort. Sharing meals, walking together, or simply having someone who understands can reduce stress and loneliness, which themselves fuel the storm. Healing becomes not a solo battle, but a shared journey across shifting weather. The scale can only tell you one story, total weight, but for metabolic health, other chapters may be more important. How your clothes fit at the waist, your stamina walking upstairs, your lab trends, your mood, and your sleep. Consider keeping a simple journal that tracks energy, cravings, and stress alongside numbers. Over time, patterns emerge that reveal where your personal storm is easing. Progress in metabolic health is rarely a straight line. Plateaus are common as your body pauses to adjust to a lower weight, new habits, or changed hormones. During these times, it can be tempting to double down on restriction. Instead, it may be wiser to focus on consistency, sleep, and stress reduction, allowing your system to integrate the changes before asking it for more. A key long-term goal is metabolic flexibility, your body's ability to smoothly shift between burning carbohydrates and fats for fuel. In metabolic syndrome, this flexibility is often reduced, like a car stuck in one gear. Over time, balanced nutrition, movement, and improved sleep can restore some flexibility, making it easier to maintain weight and energy without extreme effort. If diabetes, heart disease, or stroke appear in your family tree, you may feel doomed. Genes can raise your risk, but they do not write your entire story. Think of genetics as the initial shape of the land. Some slopes are steeper, some more prone to flooding. Lifestyle choices and medical care are the walls, channels, and gardens you build on that land. You cannot change the terrain, but you can change how water flows across it. Beyond genes, your daily surroundings strongly influence metabolic health. Availability of fresh food, safe spaces to move, job stress, sleep disruptions, and cultural norms around eating. It is important to acknowledge these forces, not to feel helpless, but to understand that you are swimming in a current. Whenever possible, adjusting your environment, even slightly, can make swimming easier. Metabolic changes can affect mood. Fluctuating blood sugar and chronic inflammation have been linked to anxiety, irritability, and low mood. Conversely, emotional distress can worsen sleep and eating patterns, feeding back into the storm. If you notice emotional shifts alongside physical ones, it is not all in your head. Your mind and metabolism are in constant, quiet conversation. While gradual changes in weight, blood pressure, or blood sugar often unfold slowly, some symptoms require urgent medical attention. Chest pain, sudden shortness of breath, confusion, vision changes, or signs of a stroke such as facial drooping or arm weakness. If these occur, do not wait. Call emergency services or seek care immediately. Metabolic health is important, but your safety in the moment comes first. When you meet your physician, you might feel rushed or overwhelmed. Preparing a few key questions can help. Do I meet criteria for metabolic syndrome? How is my insulin resistance? Are my thyroid or sex hormones affecting my weight? What realistic goals can we set for the next 3 months? These questions invite partnership rather than passive instruction. Our culture often treats weight as a simple reflection of personal virtue or failure. Yet the metabolic storm shows how incomplete that story is. Two people can eat and move similarly, yet have very different responses due to genetics, hormones, past stress, and medications. Recognizing this does not remove responsibility, but it adds compassion and nuance, which makes change more sustainable. If you live in a larger body, you may have been told that only a dramatic, visible transformation counts as success. Yet, for metabolic health, even modest weight loss, Around 5 to 10% of body weight can significantly improve blood sugar, blood pressure, and cholesterol. Sometimes lab results and energy improve even before the scale moves much. Success is any step that calms the storm, not just shrinking a clothing size. No two metabolic storms are identical. For some, insulin resistance dominates. For others, thyroid function, sleep apnea, or menopausal shifts are central. Instead of copying another person's plan, your task is to gradually discover your own map. Notice which foods soothe or aggravate you, which routines improve sleep, which supports help you stay steady. This personal map becomes your guide through changing weather. Hearing about metabolic syndrome and its risks can be frightening, yet fear alone rarely sustains change. It can even freeze us. The aim of understanding the metabolic storm is not to terrify, but to illuminate. When you see how insulin, sleep, stress, and movement interact, you can choose one or two levers to gently adjust now, instead of trying to overhaul everything at once. If this video reflects your experience, consider 3 practical steps. First, schedule an appointment to discuss metabolic syndrome and related labs with your physician. Second, choose one small nutrition change, perhaps reducing sugary drinks or adding protein to breakfast. Third, add a brief daily movement, even 5 to 10 minutes. These are not cures, but first stones placed on a safer path. Your body is not a traitor. It is a survival machine shaped by years of biology and experience. The metabolic storm, described by Dr. Emily Cooper, explains why change can feel so hard, and why you deserve both medical support and deep compassion. If you live with metabolic syndrome or its warning signs, please consult your physician to design a safe, individualized plan. If this story has helped you see your body with new understanding, please subscribe to this channel, like this video, and share it with someone who may be facing the same storm. Together, we can turn scattered gusts of effort into a steady, healing wind.